Hi, I'm Dr. Glenn Corneil, Acting Medical Officer of Health for Timiskaming Health Unit. I wanted to take a few minutes today to go over a few things and update on a few topics. Most importantly, based on what we're seeing down south, and we are seeing up north as well starting now, is evidence of community spread. What that means is it's important to start assuming that COVID-19 cases are in all of our communities and enforcing the measures that we need to do to help protect all of our communities. The Ontario government over the weekend announced that group gatherings have now decreased to 5 people or less. There are some exceptions for this. For example, households that have more than 5 people are exempt, as are funerals, which are allowed 10 people or less. Again, social distancing, which is now being referred to as physical distancing, is such an important measure to help decrease spread. I'd also like to point out that with the cases down south, there's more evidence that it's not just the elderly who are getting sick. This is not to induce panic. Most people who get COVID-19 will have mild to moderate symptoms, but it's important for young and healthy people to not assume they are going to be fine. Hence, distancing, hand washing, self-isolation is just as important for young and healthy people as it is for the elderly, especially now that we're starting to see evidence of community spread. The other thing I'd like to comment on today is the evidence of cases increasing in the south and measures the north and rural communities should be considering as well to help prevent southern spread, or at least delay southern spread coming to the north. If you're following the news, you'll see that Quebec has brought in significant measures where there are now police on the highways and police on the borders preventing people coming for non-essential reasons into northern Quebec. Ontario's not at this stage yet, but I am recommending that if people are traveling from the south to consider self-isolating if you can for 14 days once you're back in your home community. Also, we should be considering not going out of our district unless there are essential reasons to do so for the same reasons. As you also will have heard, there is law now recommending and requiring that all international travelers self-isolate for 14 days, and this is now enforceable by law. As we are seeing evidence of community spread, it's increasingly important to assume if you're having viral symptoms that it is COVID-19. There are some very useful websites out there now. Specifically, the Ontario COVID-19 self-assessment tool has been updated, and this is very useful to help identify who has an indication for swabbing. Unfortunately, due to swab issues as well as personal protective equipment issues, not everybody in Ontario at the present time who has viral symptoms are able to be swabbed. The government has released a priority list as to who should be swabbed. This is now updated on the self-assessment tool. Timiskaming Health Unit employees, as well as telehealth, as well as our primary care physicians and nurses have been updated on the priority testing as well. I fully understand it is frustrating if you have viral symptoms that you may not be able to know if this is COVID-19 or not. That being said, it's very important that we are protecting our personal protective equipment for our staff, especially in hospitals and primary care, when we start to see the wave of cases, and this is in part why there is a priority listing for testing. The other thing to remember is that even if you have COVID-19 symptoms and you are mild to moderately ill, the recommendations do not change. There is no active treatment for COVID-19 at the present time. It is all about self-isolating for 14 days from the onset of your symptoms until things clear. It is also very important now, though, that close household contacts or close contacts also self-isolate if there is somebody at home who is sick. This is really to try to decrease asymptomatic or early symptomatic transmission of the virus before people know if they have the more classic symptoms or not. I'd also like to take a second to comment on masks as we are increasingly being asked about masks, especially the types of masks that people are making at home. We know COVID-19 is transmitted by droplets. That means when we cough or sneeze, there is a spraying of droplets for the 2 meter, 6 feet distance. We assume that homemade masks can help prevent this spread as well, but this is not being studied yet. Hence, if you are a medical provider, it's important to be using the surgical masks that we are recommending in primary care setting and at the hospitals. For others, though, especially those who are working in the community, I don't think there is any harm to use your make-your-own masks. We just don't know how efficient they are. Hence, it's very important not to assume the mask is the be-all and the end-all. So continue to maintain physical distancing as well as washing your hands frequently. And we also know that in general, masks, when they are wet, are not as useful. As the waves of cases are coming closer to our district, and as we are seeing evidence of community spread in the north, it is so important that we all do our part to make COVID-19 delay when it comes into our community and also prevent people from getting COVID-19. The messaging continues to be the same. Physical distancing is so important. Frequent hand washing is so important. Staying at home if you are sick or if those around you are sick to help prevent spread in our community is essential. Also continue to do everything you can to protect the vulnerable. Stay well, stay safe, and stay informed.